Spinal muscular atrophy, also known as SMA. SMA is an autosomal recessive genetic disorder characterized by the loss of motor neurons in the spinal cord and brainstem. There is a progressive muscle weakness and atrophy over time, and it mostly affects the proximal muscles such as shoulders, hips, and back. It's caused by mutations to the survival motor neuron, specifically SMN1 gene. The survival motor neuron gene is responsible for the producing of the survival motor neuron, which is a protein essential for the maintenance and function of motor neurons. This disorder occurs on chromosome number 5 with the primary gene SMN1 and the secondary gene SMN2. SMN2 produces only a small amount of functional SMN protein. Its copy number mostly influences the severity of the disease. 1 in 40 to 1 in 60 people are carriers of the defective SMN1 gene. SMA is one of the most common genetic causes of infant mortality worldwide. There is no significant ethnic predisposition, and it affects both females and males equally. There are 5 types of SMA. They are characterized by onset times and severity. Type 0 is the most severe and leads to early infant mortality. Type 3 and 4 are the least severe forms, and they have a near normal life expectancy. SMA is usually a result of mutations or deletions in both copies of the SMN1 gene, as shown in the illustration to the right. If both parents are carriers, then the child has a 25% chance of inheriting 2 normal copies, a 50% chance of inheriting 1 normal copy, 1 mutated copy, and a 25% chance of inheriting 2 mutated copies, which means the child would have SMA. Common symptoms against all 5 types. They include muscle weakness and atrophy, hypotonia, scoliosis, difficulty with motor function such as sitting, standing, and walking. More severe SMA types such as 1 and 2 have respiratory complications and swallowing and feeding difficulties. It is important to note there is no complete cure for this disease. There are limited medications and gene therapies as seen on the left. To maintain quality of life, there is supportive care, such as physical occupational therapy, respiratory support based on how intense their situation is, ventilation or tracheostomy, nutritional support such as certain dieting restrictions or G-tube, and assistive devices such as mobility aids like rolling walkers, wheelchairs, etc. To the left, we see a child with SMA going through physical therapy. In the middle is an example of an assistive device such as a wheelchair. At the left bottom, we see floppy baby syndrome. This is typically associated with type 1 spinal muscular atrophy. This is where the baby has decreased muscle tone and weakness to the point that the baby can't physically support itself. These are my references, and that's it.